Welcome, everyone. My name's Natasha Bode, and I'm the lead for social prescribing at the Alliance for Healthier Communities. So we are doing this in a webinar format. So unfortunately, we can't see the audience, but you can see some of the panel of some of the folks who will be speaking today. And I do believe you enter and you're automatically muted. But feel free to use the Q&A to ask questions, and feel free to use the chat to introduce yourself to the group. Maybe I will just wait about 30 more seconds and then we can get started. It's so great to see people from all across the province in the chat. Welcome, everyone. It's so great to have seems like we have a good mix of geographies and roles and people. Okay, so I think we can get started. So we'll start this webinar in a good way with a land acknowledgement. We recognize that the work of the Alliance for Healthier Communities and Alliance members takes place across what is now called Ontario, on traditional territories of Indigenous people who have lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant, diverse Indigenous communities who have distinct and specific histories and needs, as well as constitutionally protected treaty rights. We honor this diversity and respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nations, Inuit, and Métis peoples in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding responsibilities to all who now live on these lands, the land itself, and the resources that make our lives possible. So I'm zooming in from Ottawa, and where we are on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. We recognize the Algonquins as the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory and uphold and uplift the voices and values of our host nation. And one thing that I will be doing for reconciliation in the near future is going on a reconciliation walking tour in Ottawa to learn more about history of Indigenous people in my area. So in case anyone is using Zoom for the first time, just so you know, at the bottom, there are, oh, next slide if possible. Perfect. So we muted everyone when you came in. You can ask questions through the Q&A, and we have many very knowledgeable people in the room who can help with answering the questions. You can use the chat function to introduce yourself, talk about your land acknowledgement, and you may also raise your hand when we get to the Q&A. So yeah, and you can react. Anyway, you know how to use Zoom, I'm pretty sure. And so the format that we're going to use today is I'm going to just start with a brief introduction to our online learning. Maybe we'll go to the next slide. Oh yes. Here's our social prescribing team. So we'll introduce ourselves. We were selected for our intelligence as well as our good looks, as you can tell. So we are led by our director, Dr. Jennifer Rayner. My name's Natasha. I'm the project lead. I think I'll introduce my team unless you want to introduce yourselves. Let me know if you want to introduce yourself. So Grace is our project liaison. Sam is our knowledge translation and communication specialist. Joe is our evaluation specialist. And Cynthia is our administrative coordinator, basically the wind beneath our wings. So that is our mighty social prescribing team here at the Alliance for Healthier Communities. And yeah, I wanted to talk a little bit about, we're here to celebrate, we're here to launch. So I wanted to talk a little bit about our online training for social prescribing. So just to give you a little intro, we started designing this training and we really knew from the beginning we wanted to have a health equity focus. It's something that sets Alliance members apart, and we wanted that to be a focus in our training. And the way we designed these online learning modules, it's for any site implementing social prescribing within a healthcare setting or in partnership with healthcare. So if you're working within or in partnership with healthcare, then this is the right training for you. And we designed it for anyone in Canada implementing social prescribing with a special focus on Ontario, and for anyone in Ontario implementing social prescribing with a special focus on team-based care. So most of our Alliance members are working in a team-based primary healthcare setting, such as a community health center, a community family health team, a nurse practitioner-led clinic, or an Indigenous-led primary healthcare organization. And we designed this training for the whole team at your center who's implementing. So not just for the link worker or the navigator, but for the primary care staff, management, leadership, the health planner, the data manager, for everyone in the whole team to take the training together and to learn together. And it was not meant to be done in one quick sitting, but rather to be done slowly over time and to be digested slowly. And then we've been working in the past few years doing some quality improvement, healthcare quality improvement training around social prescribing. So each year we're working with a number of organizations who will be part of a coaching collective. So this year we're working with 13 sites who will be working through the modules and also receiving coaching from our project liaison. So that's like a deeper way to go through the modules and for your team to learn about how the best practices for implementing health equity focused social prescribing. So we will have opportunities next year and the following year for other organizations to join in the coaching if that interests you. So we worked with some really fantastic online learning consultants from OctoD, and they did such a great job. And I invited them here today to kind of give us a walkthrough. And what I really liked about working with OctoD was we had our first meeting with them. Like I said, it's been about 1.5 years since we started this process. And we met with them and we said, okay, this is what I want to see. Like, I'm picturing like a blue background. And they were like, no, 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 you don't know what you're picturing yet, because what we're going to do is we're going to meet with many learners and people who are learning about social prescribing, people who are implementing social prescribing, and ask them what they want to learn. So I thought that was such an interesting way to work. We kind of started with a blank slate, and they did a really fulsome consultation with many of our members, which is also like a very grassroots way of working, a way that's familiar to many of us working in this sector. So I thought it was such an interesting way to work. So that's why I invited them here today to kind of give us a walkthrough. But here are, so I know Hélène will be going next, and she'll walk us through some of the modules. We also have a new module so we have our 9 modules on our health equity focused social prescribing. And then we have a new module that is just being added, and that's our clinicians module that we worked on in partnership with the Center for Effective Practice and St. Michael's Family Health Team. So that's another exciting piece of information that we have, that we heard that people want something specific for the clinicians, and we've added that too. And I'm just going to say 2 more points. I think I'm talking a bit too long, but we are going through a full accessibility audit right now to make sure that our learning will be accessible for any people with disabilities. So we're, I don't know, about halfway through that process. And we are also having the entire learning translated into French. So we will, in about a month, we will have the French version ready. So, nous aurons une célébration de lancement pour notre formation en français en peut-être dans 1 mois à peu près. So I'm going to pass it over to our colleagues from OctoD, and I'll pass it over to Hélène. Oh, sorry, did I skip through? Well, I'll come back to that at the end, but I'll pass it over to Hélène to walk us through some of the online learning.
Thank you, Natasha. Good afternoon, everyone. Cynthia, I think you're going to put up my slides, right? Yes, coming soon. That's great. Exciting. So on behalf of the October team, I'm really excited to introduce our new online social prescribing training program that we developed, sponsored by the Alliance. So this project is a perfect example of what we love to develop at Octodi. So initially, we knew almost nothing, very little about social prescribing, and we approach it with a very fresh perspective and ask a lot of questions, as Natasha said. So this process allowed us to create a highly customized resource that we are confident will be extremely beneficial for the learners, as it has been tailored specifically to their needs. So yes, starting with the next slide, please. So we wanted really to make, we aim to make this program as practical and useful as possible. So like Natasha said, to achieve this, we consulted with numerous Alliance members and individuals that are actively involved in social prescribing at various levels. So we gathered the insights on the training and resources they wished they had when starting out. So here are a few excerpts from the Zoom meetings we had. Not everybody's there, but thank you again for all that helped me, us to design this course. Next slide, please. So the result of those consultations, extensive consultations with the team and everybody, is a program that truly reflects the real world challenges and needs of social prescribing. So it includes real examples, authentic photos from actual teams, and it is filled with templates that have been tested, refined, and improved. You can see here a few of them. Okay, my next slide is about the health equity component. That was, like Natasha said, it's a major focus of this program. So this is a core value for the Alliance and member centers. So you find considerations of health equity embedded throughout the training. This ensures that the program supports not only effective social prescribing, but also equitable practices. Next slide, please. So the program, as you saw quickly before, contains 9 core modules plus an introduction, survey, etc. I'm going to do a small walkthrough for each module. The first module is called Getting the Buy-in from an Interdisciplinary Team. So we interviewed various teams and we asked them, what's the recipe for success? And their anonymous response was clear: start by getting the right interdisciplinary team in place. So that's why this first module, it's on the next slide, Cynthia. Yes. Yeah, it's a bit hidden, but so this first module provides a lot of tips on building an effective and diverse team, along with a customizable presentation template to help you achieve that goal. Great, thanks. So the second module is called Co-designing a Process Map, and it features an excellent video that explains the 5 core components of the social prescribing process. So we've also included templates to help you get started. Whether or not you have a link worker on your team, there are 2 different templates. So we've worked really hard to simplify this crucial step for you. Do I move to the next? Okay. And module 3 is called Using the EMR to Track the Client's Journey. So this third module covers why electronic medical records are essential for tracking a client's social prescribing journey. It also introduces 3 alliance forms that you can choose to use if they fit your needs. The fourth module is called Creating and Maintaining an Asset Map. So every community has valuable assets, resources, programs, people, or places that clients can connect with. So this module explores how to organize these assets effectively, whether you already have a list or not. And we also introduce a unique interactive map format to help streamline your work with these assets. And it was done with two people from the field. It's a really exciting, innovative way to create an asset map that I love. Module 5, Training the Providers, offers a toolkit to help to train providers on how to identify clients who might benefit from social prescribing and refer them to a link worker or a similar role. And as Natasha mentioned, we just going to add today an extension of that created with the Center for Effective Practice, an additional training made for the clinicians, especially for them. Module 6, meeting with clients, explore the role of a link worker. So after receiving a social prescribing referral, you'll prepare for and conduct the initial client meeting. So we'll cover that this meeting might, what this meeting might involve, how to handle follow-ups, and when to close the social prescription. So this module includes 2 conversation examples, one of which is interactive. That means you can select your answer and decide what is best to say next. Module 7, working with volunteers, focuses on maximizing the impact of volunteers in your center regarding social prescribing. Module 8, pilot testing. So once you've set up your process maps and your resources, it's time to test and refine your approach. So this module will teach you how to pilot test your social prescribing process and use a learning and improvement perspective to make practice transformations. And module 9, using data to drive improvement and program planning. This module underwent extensive consultation. It is designed to be highly useful for your teams. It focuses on using data to plan your social prescribing program and to understand the inequities faced by your clients and communities. I really loved this module. It was a hard one to craft, to make it simple enough but useful too. And we're very proud with about this module. So you have the option to complete all the 9 modules or select the one that are most relevant to your work. The total estimated reading time for the entire program is about 3.5 hours. So it allows you to fit the training into your schedule at your own pace. You have around, we estimate that it takes between 3 to 6 months to get a social prescribing program up and running, but you can complete that in your own time. And no modules are locked. You can pick and mix whatever you prefer. So this training is designed for teams. So we encourage you to participate together. This allows you to discuss and apply the content to fit your center specific needs. It's hosted on a platform that's called Talent, which recently, last week, had a major update to enhance your learning experience. So there might be a few glitches during this transition, but we're here to help if you run into any issues. So in summary, this training program is a valuable resource aimed at enhancing your team's social prescribing efforts. By drawing on the insight experiences of those already in the field, we've created practical, actionable content tailored to benefit your center's work. We hope you find it useful, and we encourage you to provide feedback to help us make it even better. Thank you for your time, and we look forward to your team engaging with the training. And on behalf of the October team, we extend really a special thank you to the Alliance, past project team members and current, for their trust, patience, and openness in helping us develop this valuable resource. Thank you.
Thank you so much, Ellen. And I have to give a shout out. That was such a great picture. So I also have to give a shout out to Katie German, who was part of our team, to Alana Camiso, to Sofia Ramirez. So all the people who supported the social prescribing team and really got us, because it was really a group effort to get us to this point. And also great appreciation to the OctoD team. It's been really a great experience working with them. So now we're going to shift over. My plan is to do a bit of a fireside chat, talking with some of the people who were involved in and consulted in building our online learning, and then we'll have plenty of time for questions. So we have a few of and there's probably lots more people in the room who were also consulted. So feel free, when we get to the Q&A, you might have answers to some of the questions. So I invited Margot Riley, who is the executive director at Windsor Family Health Team, Grace Bonnet, who is a navigator at Grand Bend Area CHC, and who was very instrumental in helping us design our asset mapping module. I invited Courtney Bauman, who is the navigator at Woolwich CHC, in St. Jacobs and Wellesley, Ontario, and Amanda McConkey, who is a health promoter at the Community Health Centers of Northumberland in beautiful Port Hope. So I thought we could sort of just have a chat about just briefly about some of the aspects of social prescribing and learning about social prescribing. So welcome everyone. Um, my first question for my colleagues here is, what is something that you wish you had known when you first started doing social prescribing? And maybe I'll start with you, Grace.
Sure. Yeah. I think one thing that I started to really embrace about halfway through the year of our funding with the Social Prescribing for Better Mental Health project was developing one-on-one connections with other CHC members and organizations that were part of that funding stream that were also implementing social prescribing. I found I got a lot out of those connections. I think anyone working in social prescribing knows that it looks very different in different contexts at different organizations in different regions. But I think those one-on-one connections really allowed you to kind of get new ideas, see what processes are working, see how you can kind of implement those within your own setting, what would work, what wouldn't work. And yeah, that was something that I felt I didn't have at the beginning and would have been helpful. But as the process went on, I really started to develop some of those connections and partnerships with other organizations and folks who were working in social prescribing, and it was crucial to my process going forward from that point on. So
Great. Anyone else? Something you wish you had known when you first started? Maybe I'll pass it over to Margot.
Um, so I think from a leadership perspective, I wish I would have known that there were resources and papers and all kinds of research that was underway in the UK and Australia. And then once I got my hand on these resources, I think I was able to create a more sophisticated type of framework for our team and just look at sustainable mechanisms for our organization so that we could work within the parameters of our current funding outside of any grants. So that was a lesson learned, and also the other little tidbit would be that just reframing what social prescribing is. So social prescribing can mean many different things under an umbrella, and at a CHC, it will be different than a FHT, than maybe a solo provider or even NPLC. So just framing it in a way that makes sense for your organization, and not feeling obliged to follow suit just because other people are doing something just might not make sense for your organization. And so that was something that I think I wish I would have communicated better to my team right from the start.
Great. How about you, Courtney? What do you wish you had known when you first started that you know now, but you wish you'd known then?
Yeah, so I think similar to what Grace had mentioned about connecting with like other CHCs who are doing this work, sort of as I've progressed in our social prescribing project, I've realized how important it is to connect with the agencies that you're making the referral to and making sure you have like a person of contact at those agencies and someone that you can make sure like, did you actually get the referral? Is this program still going? Like being able to have a key contact of where you're referring to just helps make the social prescription go a lot smoother. And I didn't really think of that when I first started out, but it's really something that I think is a really key aspect to being able to provide like an effective social prescription is having connections at the agencies that you are actually referring to.
How about you, Amanda?
Yeah, I agree with what everyone else is saying. I started trying to implement social prescribing about almost 3 years ago now at our center. And what I've learned from then being a part of everything is that building that team at your center, which we've done for almost a year now. And I would say it really is essential. And from these modules, it's good to learn that, because when you have a team that's backing and your management is backing it, it's really going to move forward much faster than if you're trying by yourself to, to get things moving and to get things coordinated. So I would say building that team is it is a really important piece, along with what everyone else has said as well.
Yeah, it sounds like it's really a collective effort. Like you need all your team on board. You need to connect with the other centers that are doing the same kind of work, and then you need to connect with those community organizations as well. Was there a module that you helped design or that you were consulted on? And can you tell us about that experience? That's my next question. So maybe I'll go back to Grace.
Yeah, sure. As was mentioned when we were going through the module, myself and another navigator from Ottawa helped with the asset mapping piece of the module. So again, through that one-on-one connection, we kind of saw the asset mapping as a bit of a daunting task, and were able to collaborate and kind of work together on developing our individual asset maps for our each of our social prescribing programs. And I know just kind of from the beginning, like I said, it was a daunting task, and I was thinking of different ideas in terms of how to start developing the asset map, starting with an Excel document, which seemed, not very user friendly, and difficult to kind of filter through and organize it effectively. And when we came up with the idea of a Google My Map, it just seemed to kind of fit all of the check boxes that we were looking for social prescribing, and has been a really effective tool throughout the entirety of our program. And actually, we're continuing to evolve and develop that further, which is great. And where we are located, we're in a rural setting. So I think the asset map is especially crucial for us, just because some of our services and resources are definitely lacking. We definitely have limited services and resources available. And not only that, we wanted to ensure that we were able to identify any gaps and avoid duplication of services. So where there were gaps, if we had an opportunity to develop a program based on that, that was great. But also the asset map allowed us to make sure that there wasn't duplication of services, so that we weren't, stepping on each other's toes, and there weren't two organizations doing the same work. So that was really helpful for social prescribing. And it also, just like others are mentioning as well, allowed for lots of partnership opportunities and collaboration with other organizations. Just easing the process of external referrals for social prescribing and things like that as well. So yeah, certainly if anyone has any questions specific to developing an asset map for their program, more than happy to answer that. I won't get into too much detail in terms of the background. The module goes through all of that information, but definitely highly recommend this step if you are implementing social prescribing. It's been really increased the efficiency of our program. So.
And shout out to Joseph at Carlington, because he made the videos on his phone, so he walks you through it. And yeah, but Grace and Joseph were really, really instrumental in that module.
I just see a question in the chat. Are there concerns or limitations about Google My Maps? Example being able to sustain the volume of assets. So there are, within the layers, there's a limited number of layers that you can have. And I'm not exact, I forget what the number is. I want to say 8. So those are kind of like the overarching categories. So, exercise and fitness, social opportunities, health services. So you can only have 8 of those kind of categories. In terms of the actual pins on the map, so far, no, we haven't come across any limitations. Our map isn't entirely comprehensive yet. Like I said, we are still adding to it, and we'll continue to do that. But I don't see any limitations with it so far. So,
great. So my next question is does anyone have a favorite part of the online learning? Was there a favorite module?
I think overall, I'm really happy that there's kind of like this one-stop place that you can get all the information, because I remember when I first started and there was like a month straight where I was like going to all these different websites and all these different places and reading this and reading that and trying to like have it all in one document and all organized and everything. So it's really great to have like one place that identifies all of those kind of like key foundations of social prescribing that you can look at, and you don't have to try to like scramble to all these different websites. It's great to have information from a lot of different places as well, but when you're first starting, it can be very overwhelming to be like, where do I get any of this information? So to have everything in one spot that you can like walk through and see what you need to all prepare and stuff, I think overall it's really great to have that all laid out.
Yeah. Anyone else have a favorite?
I would just say it's just really interactive, which is really nice. Lots of real life examples, I think, which is always helpful too, because when things are, they're happening, or also you might see, oh, it's from this center, I could reach out. As Grace was saying, she's happy to help people with asset mapping. So there are people that you can connect with that maybe have a bit more expertise in certain areas, which I think is really great as well.
I think my favorite section is the meeting with clients, because it's like, oh, like kind of like you say, if you say this is how it's going to make your client feel, and that's the real, that's the sauce of what we're cooking up here. But then my least favorite is the data one, only because it was so much work to get it right. So people who are real data experts wanted more detail, and people who were new wanted less, and it was very challenging to get the right balance of, the Goldilocks version. Yes, worth it to get it right, 100%. Okay, here's a general question. What is one of the most important things about social prescribing from your point of view? So maybe I'll start with Margot, like as a leader, like what are some of the key details about social prescribing, and what's something maybe unique that you do in your setting?
Sure. So what I do really like about the training is that now we actually have a platform that we can bring our new staff. We have nurse health promoters, and we've added this program to their complement or their menu of services that they offer personally. And so that was part of our integrated model for sustainability. And so we did redesign the position, and part of that is also reframing how they complete their work and how they prioritize their work. And it is when you're working within the health system and you're working with healthcare providers who may already feel like they do a lot of this type of referring, it's really hard to reframe that perspective, because we're trying to teach something different and to look at healthcare in a very holistic way, right from their primary care setting. And again, this goes back to CHCs may look different, a little different than FHTs and et cetera. And so we really have to look at speaking to everybody who's on the team. And at times, because we have nurse health promoters doing the work, this is work that might be considered very social worky, we'll call it. And so to include that clinical aspect to the way that we run the program, and we have to make sure that it's within scope and et cetera. I found that the modules fit very nicely with the way that an RPN, for example, would need that complementary resourcing to complete that role. So for example, the training goes through every aspect of how to have the conversation with a client, but why is data important, and how to track the asset maps, and what are different ideas. Like we use 211 in our region, plus a spreadsheet, but this is now a different element. And so it offers different creative solutions that we would have never been able to think up on our own potentially. And so through the collective, there was more power and more resourcefulness, because now we're not thinking about everything independently, because now we have the modules that actually spark a bit of innovation and creativity, and maybe we can use those ideas as a benchmark and to do something a little different. And then Natasha, you had asked what is something unique about our social prescribing program, and I think what we do that's a bit different is that we just look at it from a different perspective, and so we're always looking at the bigger picture and how we can integrate some of these models into the Ontario Health Team, and how our organization can be leaders within the region as it relates to system navigation. And if 211 is part of our navigation system for the Ontario Health Team, then now there's no excuse. We can all use 211. We all can have a social prescribing program. So it's those initial conversations that I think that makes our program unique, because we're looking at a community program, I guess, and then we're looking at the umbrella and we're saying our organization does not have this program. Who else has that program? And so we add to the numbers of participants for that program instead of creating our own. And then when we don't have the program, we talk about, so what are the needs of the community, and can we create something that will meet the needs and invite other community partners to refer their patients to us? So that's the point that we're at, is that non-duplicative services and how we maximize our resources. Because we all know from a leadership perspective, we're all looking at funding and maximizing resources. And we know that funding is very limited, and sustainability is something that we always have to think about. Very long-winded answer, but
that's super helpful. We don't have to do everything. We can look and see what existing resources and build those partnerships. That's really helpful. Thank you, Margot. How about you, Courtney? What would you say is like the most important part of social prescribing, and anything unique you're doing at Woolwich?
So I think for me, the most important part of social prescribing is recognizing that it's going to look different for each individual. And there's sort of the same overall goal and thing that you're trying to accomplish, but each individual is going to take a different path to get there. There's no one set way. And I think especially like in the population we serve a very rural population. A lot of them, they don't have internet, they don't have cars. So there's a lot of barriers in place that are preventing them from accessing a lot of activities and things. So looking at how we can address those in ways that still fit with something they're comfortable with. Like obviously I'm not going to send them to like an online group or whatever. So just recognizing everyone is going to be different, and you have to look at that person as the individual and say like, what are the steps they need, even though they might be going the same place as someone else you spoke with, but it's going to be a different process and different supports to get them there. And I think unique, like in our CHC with the rural population, some of the asset mapping and things, it can't be done on Google, because a lot of it, like in the rural population, is these individuals within the community offer rides to people who are horse and buggy and they can't get to an appointment that's an hour away or things like that. So the asset mapping in our community looks a little different, because you really kind of have to form those connections with the direct community itself and figure out like, okay, who's able to give this person a ride, or how can we help this person connect with this resource here. So I think that's something that's kind of unique to our center, is just finding those resources within the community and building on from there within kind of their safe space and what they're comfortable with.
Love that. Yeah. Amazing. Thank you. How about you, Amanda?
Yeah, I mean, I agree with Courtney and Margot are saying as well. I kind of have two things that I think are important. One is that, which I think everyone would agree with, that connection with your client, that you're working with their needs, where they're at, you're meeting them, because sometimes you'll find the clients, they're not ready, but I find doing check-ins and just building that relationship with clients, you really find then that's when those breakthroughs happen, or they feel more comfortable to reach out. The second thing, which I know people don't find as fun, is that data collection piece, and we're entering that really now, but it's really important to have collect your data and get it into your EMR, because if you want to continue these types of programs, I know, like, I've been working in community health centers for over 16 years, and we've been doing this work for a really long time, but we've never really documented it. And to be able to show it and how it improves health, how it supports people, then we can get more of that funding. Maybe we can reach out to the government, right? Like, these are the pieces we need. It's not fun, but I do think it's really essential to continue this great work that we're all doing.
I totally agree. Thank you for saying that. And how about you, Grace?
Yeah, I agree with Amanda. I think that data tracking piece and the EMR tracking piece is really important. I think a lot of community development and health promotion work often doesn't include those aspects in the work. So I think with social prescribing having, a bit more of a formalized and standardized process of doing that, it can really not only help to show the impact of the work that we're doing to receive funding, but also allows us internally to really optimize our programs and find opportunities for efficiencies as well. I know we've used lots of our data to kind of look back and see how we can improve our processes based on that. I think there's some barriers to that as well with just, internal staff capacity, whether you have someone who's actually analyzing that data on a regular basis. That can be a bit of a challenge, but definitely I think having that information in the first place is very important. And on a bit more of an informal client-facing piece of social prescribing, what I've noticed throughout the process is the check-ins with clients are so important, and the impact it has on the individual is significant. And I didn't really realize that before, but a simple call to check in on someone and say, hey, did you attend that exercise class that I sent you to? Or, how are things going? How's your winter going? It's been a long, cold winter. How are things? The impact that has on the individual is so significant. So I can really appreciate that social prescribing puts a bit more of an emphasis on that, because I think that's often missed in a lot of client-facing roles. So if for anyone who's doing social prescribing, I really encourage you to make sure that that is part of your process.
Great. Well, thank you so much to our panel today. I really, really I think your experience and your insights and your that this is why we consulted so many of our staff in our member organizations, because you bring so much wisdom and knowledge and experience. So thank you to all of you for this nice conversation. So we have a few minutes left for questions, so we can go through some of the questions if there's any in the Q&A, or if you've put them in the chat, and we have a wide range of people here who can answer them, and we probably have a lot of expertise in the room as well outside of our panel. So maybe I'll go to the Q&A and see what the first question is there. Oh, this is a common one. Do you have any recommendations for getting physicians or healthcare engaged with social prescribing? Anyone feel like they want to answer this one?
Oh, I mean, I can just jump in the sense of knowing I was kind of doing it on my own to building a team. Is if you build that team and you have some primary care providers, or we have our clinical director on our team, then they're your advocates too. They make it a part of okay, this is a part of what you're doing. So that's kind of my 2 cents, is that you just really need to have some of those advocates on right there on the clinical side as well.
Yeah, go ahead, Margot.
Kind of a more pragmatic sense, because I'm looking at it from a leadership perspective. I found that because I was really engaged in the program and I was willing to put effort and time, and I was supporting the team, I found that it gave the clinical team a moment of pause to really understand why is the ED really involved in this, and why is it so important to her, and it really is, from my perspective, just explaining, okay, this is what you think you're doing, but we live in an urban center, and there are high needs, and downtown's just down the street, and we are seeing those vulnerable people in our center. So how can we support them? And then there was also another driving point that I think is important for the group to kind of consider is as we are collecting sociodemographic and race-based data, we actually have a responsibility to use the information that we collect for the provision of healthcare. So if you are collecting sociodemographic data and you are not using it for any other reason, having a social prescribing program does help support the reason behind having that data, because now you can look at the data form, which is embedded in your chart for the patient, and you can use that information to benefit the care and provide health and wellness services to that individual. So that is my privacy officer hat that's coming up. But yes, you never collect anything you're not going to use. So, but that definitely those 2 points I would contribute to that conversation. Oh, and lots of examples of successes.
Yeah, I think when the clinical staff see the results, that helps them really want to support this kind of work. I have another question, I think. Actually, I think it's the same question. Oh, there's questions in the chat. Okay. Are there any specific monitoring, evaluation, materials, resources that can be shared with people implementing social prescribing at CHCs in addition to what is already provided in modules? So I don't know if that's kind of more of an alliance question or I think maybe what Courtney talked about a little bit earlier about connecting with the CHCs who are working in similar settings, and they can share some of the resources they've used. Another great place is our community of practice. So we have an Ontario social prescribing community of practice that meets every second month, and that can be a great way to connect with your peers. And there's also a national community of practice that meets quarterly, and my last slide has the details about that. Any other thoughts about resources that can be shared?
There's the Center of Effective Practice, and there's the toolkit for health professionals. That I find that I lean on that sometimes as well.
So I'll just open the floor. We have a few minutes left. You can raise your hand. You can put a question in the Q&A. You can put it in the chat, and just let us know if you have any questions about the online learning modules, about social prescribing in general. We have lots of expertise in the room if anyone has any questions. And we also have our learning consultants in the room if you have questions for them about how they developed it or how anything about the online learning modules. So I'll just pause for like 10 seconds for those shy people who maybe have questions about the learning or the modules or social prescribing. But I'm not seeing any questions coming up. So maybe I'll go back to sharing my slides, but still opportunities for questions. We are holding space. So here are some upcoming events. So every year, the Alliance for Healthier Communities supports Community Health and Wellbeing Month, which, well, usually it's a week. This year we're having a month, and the theme is the future is community. So we will be doing some in-person events at some of our member centers. So feel free to invite us. We want to come and see what's happening across Ontario. We will be organizing a human connection event. So if you are doing in-person human connection events, let us know, and we will have a repository on our website. We will be doing a webinar on our next webinar will be Monday, October 28th. We're going to be sharing our final reports from our social prescribing for better mental health, from links to well-being, and just some overall successes on social prescribing at the Alliance. So you can already register for that. There's a National Social Prescribing Conference coming up September 26th to 27th in person in Toronto, and we will be presenting our Black Focus Social Prescribing. We'll be presenting on their work, and we will be presenting on our Links to Wellbeing, social prescribing for older adults, as well as our social prescribing for better mental health projects. So that will be exciting. And then, as I mentioned, our Ontario Social Prescribing Community of Practice is coming up on October 17th. You can go to our website to self-register for that. And yes, you can definitely go and check out on the Center for Effective Practice. That is our clinicians social prescribing tool, and the module will be up and added. The clinicians module will be added within the next 24 hours to our list of modules, and so any of your clinical colleagues can definitely register for that. And next slide. I don't remember what the next slide. I think the next slide says questions, maybe. Oh yeah, no, so feel free to reach out to us if you have questions, if you're feeling shy, but it brought up some questions and you don't feel like asking. And we have 3 minutes left if there's any questions about the online. Oh yes, at our next community of practice, we will be discussing evaluating social prescribing. Hey, this is the last call. Does anyone have any questions or comments about the online learning modules or social prescribing? Okay, well, hearing no questions, I would like to really thank my panel. I'd like to thank Maria and Hélène for your great work designing it. I'd really like to thank Courtney, Amanda, Margot, and Grace for being part of my panel. And I would really like to thank my Alliance Social Prescribing team for making everything work so well here. And I will linger for a few minutes if there are any other questions. Thank you so much, everyone, for being here, and wishing everyone a great rest of your day.